Again, I want to welcome everyone to our November Healthy New Moms webinar series. My name is Roni, and I work as the Child and Family Program Manager for the Mental Health Association of Maryland. Our program works to raise awareness of perinatal mood and anxiety disorders and offers support and resources to moms, families, and providers across the state. You can learn more about Healthy New Moms by visiting us at www.mhamd.org. Today's session is being recorded and will be made available to you in the coming week. And I will talk about this more later, but certificates of attendance are available. These are not CEUs, and more information will be shared at the end. According to research studies, approximately 1 in 5 fathers experience postpartum depression. Yet, paternal mental health is often overlooked, even though it plays a crucial role in family well being. This month's webinar series will shine a light on the experiences of fathers during the perinatal period. Participants will gain insight into the emotional and psychological challenges fathers may face, including risk for depression and anxiety, and explore how paternal mental health influences maternal outcomes and infant development. The session will offer practical strategies for effectively engaging fathers in perinatal care and mental health conversations, fostering stronger support systems, and promoting healthier outcomes for the entire family system. Today, we are joined by a wonderful guest speaker. Verlene Harry is a licensed mental health therapist, professional or personal development coach, and wellness trainer with decades of experience advancing mental health and resilience. She has spoken at national conferences, corporate seminars, universities, and podcasts sharing evidence-based strategies for well-being and empowerment. Appointed as a national ambassador for the U.S. Department of Health and Human Services National Women's Health Week, Verlene is recognized for her passion, knowledge, and leadership in promoting holistic health for women, families, and communities. In her local community of Charles County and the greater Washington, D.C. region, she has led outreach initiatives that foster connectedness and mental wellness. As both a professional and mother of five, Verlene brings a unique, compassionate perspective to supporting maternal mental health and wellness. Verlene, we are so happy to have you with us today, and I will pass it over to you.
Good morning. Good morning. Thank you, Roni, and thank you, all of you all who have joined in this conversation today that I will be just leading, but hopefully you all will be interactive as well in your thinking and your thoughts and any comments that you may would share as we move along. I am so grateful to have the opportunity to speak on health and wellness as it relates to our fathers, because sometimes may forget them in conversations, but I'm so grateful to be able to just kind of highlight our fathers on today. And even as I was sharing my topic and what I would share today with my husband, just even getting some feedback and hearing some things that I never heard in conversation before. So even getting even more insight for myself on us and what that looked like in our journey of raising or having 5 children in the early part of our journey in parenthood. So I'm just grateful again for this opportunity. But I just want to just start off by just kind of engaging in conversation in the chat of one word when you think about fatherhood. What comes to mind when you think about fatherhood? Let's just begin to kind of interact in the chat of one word when you think about fatherhood. Okay, Parlin says duty, protection. Denise says strength. Carrie says stability. Yes. Strength, pride. Leader. hmm Yeah, and I was looking at just a couple of short passages of fatherhood, one by an unknown author and one by an author of Antoine Prevost. And it says, a father is neither an anchor to hold us back, nor to sail us there, but a guiding light whose love shows us the way. Another piece says, a heart of a father is a masterpiece of nature. In his strength, we find comfort. in his silence, wisdom, and in his love, the quiet rhythm that steadies the family's heart. And I thought both of those were beautiful as we just kind of consider the importance of fatherhood. Okay. I'm going to share my screen now as we get further into our conversation here. Okay, I believe that is. And again, our topic is Fatherhood Matters, elevating the role of fathers in perinatal mental health. And as we know, that's talking about from the conception of pregnancy on to the first year of our journey as it relates to pyramid. Okay, let me see. I think I need to get another. I'm going to just share this again. Let's see. Let's start here. Okay, there we go. All right, it's moving now. Okay, and then some of the objectives or key goals of our session is to explore the emotional and psychological experiences of fathers during the perinatal period, including risk factors for paternal depression and anxiety. We'll also just kind of look and identify the impact of paternal mental health on maternal well-being and infant development. We'll discuss some barriers that prevent fathers from engaging in perinatal mental health care and consider discussing or just kind of considering strategies to engage fathers in perinatal care and mental health conversations to support the entire family unit. Because as we begin in our conversation, we'll begin to see that it's important that we consider the well-being of the fathers because they can have an impact for the well-being of the entire family. Okay, right. This picture's up here. Why fathers matter? Why do fathers matter? Just want to share a couple of statistics with you as I was just in research and just some things that just would cause us to consider this even further and deeper. 1 in 10 fathers experience postpartum depression. Also, research has shown that approximately 18% of fathers experience significant anxiety symptoms during the perinatal period. And then research also just goes on to just kind of elaborate and show that when mothers experience perinatal depression, paternal depression also rises up 24 to 50%. And we can probably already relate to that as we were just kind of putting in the chat. Some of the words that we put in the chat were strength, right? Leader, right? All those things and expectations of what we consider fatherhood to be and in the role of the family. Fathers who receive emotional and educational support during pregnancy have been found more likely to remain engaged in the postpartum and the challenges that the mother may be facing as well. So, fathers' mental health can impact maternal recovery and infant outcomes. But oftentimes, our fathers are overlooked in our paternal perinatal care. Let's just consider and just kind of just reflect on some of the emotional and psychological experiences that our fathers may face. Risk factors: sleep deprivation, financial stress, relationship strain, adjusting to new family dynamics, and then also considers what is the masculinity norms in society that usually discourage vulnerability as it relates to fathers. And so, all of these things, as we are just considering how the fathers are being affected and struggling emotionally, even if the father isn't saying it outright, sometimes they show signs by withdrawing from their partner or the baby or even friends, right? Sometimes you may see signs of irritability or anger or the father being short tempered. They may even show signs of, as you see them working excessively or avoid home to escape stress as they are dealing with depressed mood symptoms and anxiety. or they may show less interest in their activities that they once enjoyed. So these different signs should not be ignored, but they should be considered as it relates to the mental health of the paternal aspect as we relate to fatherhood. Sometimes they may even appear detached or emotionally flat because they're also in the realm of trying to understand what their emotional space looks like at this time. All right, so our engagement question. Again, we can just kind of either come in the chat or since we have a small group, if you want to use I don't know if you have the hand gesture motion or if Audrey will be able to tell if you want to come off of mute if you're in a space where it won't be any background or feedback. But if not, you can just put it in the chat. We can read that as well. But what barriers might prevent fathers from opening up about their mental health? One of the things that I often say is that with any situation, when you're talking about mental health and wellness, I always use providing a safe space. And my acronym for SAFE is a sincere assurance that they're free from embarrassment. A sincere assurance that they're free from embarrassment. So providing a safe space for fathers is one of the major aspects that we can provide for fathers to be able to open up about their mental health. Would anyone else like to share what they think are some of the barriers that prevent fathers from opening up?
I'll share.
Okay,
One
go
of
ahead.
the things that I feel is most fathers have the statistic of being strong
Mm-hmm,
and of not having mental health. And especially in the African American community, it's hard to take diagnosis or like there's something wrong. Like,
mm-hmm,
get yourself together,
mm-hmm.
go to church, pray about it, everything's at church.
Absolutely, Nick. And again, just using that word that we mentioned for that strength. Sometimes that strength is compared to them not showing any emotions or any distress. But sometimes that strength should be that they're getting up and they're using some of the same tools that we are encouraging our maternal mothers to do, and what that looks like to get the help and the support that they need. Yes. Thank you, Nikki.
And we have a couple in the chat.
Okay.
Cynthia says the desire to remain strong.
Yes.
Rachel says stigma associated with their mental health struggles making them weak.
Mm-hmm.
Denise says fear about being judged and feeling as if they are weak. And then Parkland says expectation to be strong, fear of breaking family stability by looking weak.
Absolutely. Yes. Thank you, Sydney. All of the people who added to that, because all of that is a combination of the barriers that they face. If you just think about even the some of the just the scene when they're getting ready to even go home, that father just getting the car seat ready and having all of the emotions together, and being able to tend to the mother's needs and all of and what that looks like. But who is checking in with the father? Where is that space for him to say, I'm anxious about this? This is a new role for him as well, just as it is the mother. And the distress of the strength that they are used to providing, even for their partner, and seeing spaces that they can't really help out in. They feel helpless. They feel, that sense of vulnerability when they can't, or when they feel like they can't be an assistant to some of the symptoms that they may go be dealing with, even something as just prevalent as nursing or just things that they would go through, and they feel like that they can't be able to, and what they sometimes feel like they need to do is fix it, right? Yes. I think Denise has her hand raised.
Yes, hi, thank you.
Hi, Denise.
I was in another training a couple of weeks ago,
Mm-hmm.
and it was about fathers as partners. And one of the things the gentleman said is that men are socialized to internalize.
Mm-hmm. Mm-hmm.
And that just makes me think from little boys are little, they're told, don't cry, don't do
Right.
this, you better not, you don't
Hmm.
talk about certain things, so I think as you become an adult, it continues it. So when you're older, when it comes an issue with your mental health, you're told not to talk about things like that, and you remember it, so you just don't.
Absolutely. Absolutely. Yes. We have time for one more if anyone wants to just kind of join in. Okay, I think we mentioned, yes, some definitely something that we can continue to consider as it relates to reaching out and providing that safe space for our fathers as it relates to paternal mental health. You all mentioned about traditional gender roles, just how historically centered around mothers, and then someone even mentioned cultural expectation. Sometimes we use terms like staying strong, suppressing emotional vulnerability, all of the things above. And even when it relates to as it relates to our healthcare systems, there can be some biases in that as well. I think we are, and I believe that we are evolving to a better space when we are providing even psychoeducational information for our fathers. It used to be where it was just all you go into the room and it's just all about the mothers, right? Mothers pamphlets and all those different things. Now I'm starting to see where they're using even terms of parenthood or caregiving, terms just to include the fathers as well in the information that they would provide. So even in our healthcare system. Also, research gaps. Research is now it's being there's more research that's being initiated on what the father's role is and in paternal mental health. All right, and one other area that I just would like to just kind of just for us to consider is the workplace barriers. You all know that usually it was just about the maternity leave for the moms, you know. And now, as we are seeing the spaces evolve to even support that time off for the fathers as well, because they were just conditioned to when this was over, go back to work, and what that looks like and have everything, operate as normal, not even considering that they may need that space as well to adjust to all of the things and that's taking place. And if the father is in the home and helping and partnering with that caregiving, those caregiving roles and tasks, they are being sleep deprived as well. So, for the most part, yes. So, those are just things that we just continue in our conversation. All right. Just how it can be affected or connected in the overall well-being of our families. Again, I'm sorry about that. Again, we want to just kind of just think about and consider the influences of maternal stress and well being. If the father is getting the support that they need, and not only that, but just getting informed about more and more educated about what the mother may be going through, they're able to better support. They're able to better to be present more and to help with the maternal stress and well being. If they can get that support as well, and also the understanding of what that looks like. And so when we're thinking about what are the factors of why we should put time and effort and consideration into paternal mental health, we have to think about the family as a whole, that as you are supporting the father, you're also supporting what we're normally used to supporting the mothers as well. All right. It has also been connected in research that it affects infant development and bonding as well. When that father can be present and practice tools of wellness as well as it relates to bonding and developing and also assisting in the care and what that looks like for the infant, that has been shown in research to have long-term effects as that child evolves and grows. All right. And family stability is linked to paternal well-being as a whole, as they are receiving the support and the education and the consideration on what that looks like for their well-being as well. some of the emotional experiences as we're thinking about our mental health, the paternal mental health, is just understanding that they feel pressure, again, as we talked about, to provide not only financially, but emotionally and physically for their growing family as well. So they're having those symptoms, and it may just look different, but it's the same underline of anxiety and worry. What is that going to look like when they're looking at their family, looking at, okay, now I have this responsibility that's on my shoulders, this weight, and how do I navigate with that? How do I deal with that? Right? Again, we talked about the identity shifts, transitioning into fatherhood can be that uncertainty about what should my role look like, especially when it comes to the first child, of just shifting overnight seemingly, but it's been a journey, but seemingly to them, that pressure can feel like overnight I'm having this role and I'm navigating something in a place that I've never been before, right? The emotional overload, also balancing work, supporting their partner, adjusting to new routines can lead to emotional burnout and emotional numbness. And so those are the things that we continue to see as we begin to understand the paternal mental health. All right. Sometimes guilt or helplessness, as I stated before. Some father struggles with feeling inadequate or guilt for not knowing how to support their partner effectively. And that can be a great weight on just the makeup of sometimes how they navigate through their emotions when they can't feel like that they can fix it, sort of speed, or have an answer to, or make it well. And so as we are beginning to support them and give them tools, we begin to share with them, just sometimes just being present, sometimes just validating what they're going through is sometimes enough for the maternal mental health and wellness of what that looks like in that space when anxiety seems to be high and worry seems to be very stressful in the moment. All right. Okay. Again, we talked about understanding the challenges that they face. And we talked about how healthcare systems focus mainly, has been known to focus mainly on the mothers, whether it's in the classes, in the support, even in the screening, in the initial screening, when you think about the screenings that the mothers are getting in the early care of their pregnancy and all of the things that the screening is usually geared around the mother's well-being, and the fathers may be present in their appointments, but that's an area that the healthcare system can begin to focus on, is screening of the fathers as well, some of those questions that's being asked. And again, someone mentioned earlier around the stigma around mental health. These are some of the barriers that we talked about. And the paternal leave, workplace report, and again, fewer providers providing screening for the fathers. Okay. All right. Let's talk about what changes could healthcare providers make to include fathers in perinatal mental health care. And there's no right or one answer, but I just want to just get your thoughts on what do you think would be some of the things that they could at least consider when, as it relates to including fathers in the healthcare arena or sector. And again, you guys can come off or either you can come in the chat. Okay, looks like I see Cynthia has her hand raised. Cynthia, are you able to come off mute?
I am. Hi,
Okay,
guys.
go
How
ahead.
is everyone today?
Hi, great.
Good, good. So I wear many hats, but one of the hats that I wear is as a lactation consultant,
Mm-hmm.
and I work in the hospital doing that.
Mm-hmm.
One of the things that I've actually began to look at for quite some time is how the fathers kind of blend into the background.
Mm-hmm.
When practitioners come in, they, kind of take the more submissive role. So one of the things that I've tried to do in my practice, and it's a little weird because we're talking lactation, but is to really get them involved in that.
Mm-hmm.
And from a hands-on approach, right? So
Hmm.
sometimes we're seeing more traumas with
Yeah.
our moms, and their recovery is looking
Hmm.
different than we've seen it before. They're weak,
Yeah.
they don't have the energy, I mean, not even to breastfeed their babies.
Hmm.
So one of the things that I do to actually get the fathers engaged is to
Hmm.
teach them how to hand express their moms. And we do it in a like
Yeah.
joking, lovingly way. It's like, you're already familiar with these breasts, you know what they do. We're just going to,
Right. Yeah.
position them in a different way. Now we're going to
Hmm.
use them as a food source for the baby. And,
Hmm.
it kind of allows them to just relax for a second, just to
Yeah.
laugh and be like, oh my God. I'm like, you can breastfeed, you really can.
Hmm.
And, just making light of it, but also giving them the opportunity to have a moment of pause and to see that they can be just as impactful in that mom's recovery and feeding that baby.
Yes, absolutely. That's wonderful, and that's great. What else have you seen as far as when you began to engage them in the thoughts? How are they responding? What are some of the responses that you're getting after they get past that being uncomfortable?
It kind of ebbs and flows. Some people
Hmm.
really like get so excited, and it's almost like you've given them permission to be able to take on that role when realistically
Hmm.
they have it anyway. So
Hmm.
to see them, I tend to do my hours in a row, meaning I do 3 12s in a row.
Hmm.
To see them the next night when I come back, and I'll walk in the room and they're like, "Oh, guess what? I hand expressed and I did whatever." It
Hmm.
really is rewarding. And then you still do have some that are like, I don't want no parts of this. I'm just going to sit back here in the corner. And, you try to engage with questions or just really making sure that they understand the information that's being disseminated to mom, because when they
Yeah.
go home, that is really their support system. So some engage, some just kind of sit back and listen. There's a little bit of everything in between. But even with the ones that sit back and listen, I really believe that they focus on everything that's being heard. So when they are home in their place of safety and security,
Hmm.
they can then act on, what was taught at the bedside.
Yes, absolutely. And just to even have that liaison or that support from hearing it from a healthcare provider that the
Mhm.
mother is experiencing this and she's going through these emotions. It's just not her just being frustrated. These are some of the things that she's dealing with and that, that will help and that support of them. When they can get that psychoeducation and understand it from even a health care provider, they're more apt to be more understanding and patient and working through that process to be present. So yeah, absolutely. Thank you, Cynthia, for
You're welcome.
sharing. Yeah.
Hmm.
Is there someone else that can share either something that was challenging that you saw in the healthcare system that you wish would be a better consideration in moving forward, or you could even talk about changes that you've seen for the better as far as it relates to the healthcare um, environment. Okay. All right. We'll continue on. All right. I want to go back and just kind of even and not skip over the cultural expectation of just not only the gender role, but even sometimes in different multicultural aspects of what that looks like as far as fatherhood. So I want to just kind of just get your thoughts on how that can be a challenge culturally, whether we're thinking about the dynamic of just what it looks like to be as far as the male gender role and what that should look like, or either someone earlier mentioned just even in a certain community, what that can look like as it relates to fatherhood and how that can just affect the thought of them receiving the support that they need. Would anybody like to share any thoughts on that, of how culturally it can be a challenge? Okay. I can't see the chat if there's something in the chat, but okay. All right. Good. Good. You guys just are receiving. That's okay too. That's okay too. I just like because oftentimes, sometimes an experience, a shared experience can sometimes even bring even a further consideration or thought as to some things that we never thought about before. And so those are some of the things that we want to just continue to just kind of grow in and think about. I also want to just kind of touch back again on some of the just the emotional overload with the balancing of the work and supporting their partner and adjusting to those new routines, right? Being able to provide the support to just validate that it is overwhelming, that it's going to look different. It may be look different, but you can adjust in different ways to be supported, and what that looks like as far as the just the routine that they were used to, or just being able to feel like that they can be able to have that space to say, hey, it's just a lot right now. And be okay with that. Yes, it is a lot. It's different. It's more things that's being added to your plate. But how can we now navigate and get the support that you need? Okay. Now I want us to just think about exploring even the more effective methods to involve the fathers. All right, to involve the fathers. One of the ways that we can consider, and I believe I'm seeing more of this evolving, is including fathers in prenatal visits and education. Including fathers in prenatal visits and education. Okay, so it's not them just showing up at the appointments and just checking off the box. Oh, they came to the appointment, but including them in the conversation and in questions that they may have. And it may seem to them a little awkward at first, but just being able to be in a position where you're continuing to encourage them and continuing to validate them and to continuing to letting them know how important they are to this process, and then that can promote more of the engagement. Okay.
Yeah, sorry. She's working
Yes.
on.
Did someone have something? Okay, I think they was just coming off. Okay. All right. Again, screening the fathers, as we mentioned before, for depression and anxiety, you know, throughout the process, from the beginning, right, into the birth and throughout. So just as again, as we saying, the mothers are having those checkups, those check-ins, I like to say, the fathers being included as well, right? And that can be encouraged. That can be encouraged through the healthcare. That can be encouraged through the maternal spouse as well, and what that looks like, and being able to also educate the mothers on how that they can have some conversations of check-ins with the father as well, because as they can see that as they connect and be concerned about the mental health of their partner, right, and the father, that it's also going to be that added support for them as well. Again, we talked about using father-focused language in our materials. And we talked about that can look like parenthood, or that could look like using the word caregiver, because that would include both the mother and the father in that. Also encouraging peer support groups. Peer support groups. Is there anyone on here that can share of any support group that they know of that supports fathers in paternal mental health? If you do, if you can share that, that would be helpful to everyone.
Hi guys, it's me again, Cynthia. I am also a member of PSI,
Mm-hmm.
which is Postpartum Support International, and they have a plethora of different programs that are out there. But they do have one that is specific to dads. So, I mean, you can certainly just go on the website. I'll try to get the link and put it in the chat.
Mm-hmm.
But they have one that I would definitely recommend.
Wonderful. Yes, yes, definitely know about that one. Anyone else?
Okay.
I'm sorry, I couldn't find the raise your hand button. How
That's
y'all?
okay. Hi, Sharina.
My name is Sharina. I work with Baltimore City Health Department,
Mm-hmm.
and a lot of our home visiting programs, they
Mm-hmm.
also offer the support of fathers. I know they have a program called Fatherhood, and
Mm-hmm.
that also includes dad in the whole process of the maternal as well as postpartum process of with the moms.
Okay. Can you share about what some of the things that is happening well that's well been happening in the program as it relates to fathers and how they are engaging?
Well, I'm not a part of the programs, but I do know that they have like Zoom meetings with the father where
Okay.
it's a peer-led meeting and other fathers who are also newly fathers or fathers that have been, a father. They're all on that same Zoom meet and they support and uphold each other. They give
Mm-hmm.
advice, they share their experiences as being a father.
Mm-hmm.
Um, they also have like resources for them, support services. Then they also have groups where the pregnant woman or the mom and dad both are encouraged to participate, and then they support them both with that.
Mm-hmm.
Yes.
Yes, thank you, Sharina, for sharing that. Yes, we know within the wellness field that whenever we can engage in a peer support group situation, that's normally a high percentage of just wellness practices that they can be strengthened by. Just the fact of them knowing that they're not alone, right, and they can hear common themes, common conversations, and support and feel supported in that area. Also just finding out sometimes as it relates to father, just providing the kind of virtual type of setting where they can do their check-in. Sometimes they feel less inhibited to participate if they don't have to feel like that they are coming in person, and what that could look like as it relates to their mindset of feeling vulnerable. So, the open door that has happened to virtual spaces, we're finding out we're really being strengthened to receive more participation as it relates to mental health and wellness as a whole, and specifically to paternal mental health. So, absolutely encouraging with that.
And I
Anyone
just want
else?
to do
Yeah, go
a
ahead.
quick recap. I said
Yeah.
postpartum support international, and it's not. So it's perinatal support international. So I do apologize for that typo, but
Okay.
or that
Yeah. Yeah.
misreference,
Pernil.
postpartum support international. But
Yeah.
their
So I had that
link is
as one
now
of the
in
resources.
the chat.
Okay. All right. Yes, the link is in the chat for Cynthia said the link is in the chat for you all to just explore that resource as well. All right. Again, I can't see if anyone's in the chat. Did anyone else have anything to add to that? Okay. All right. All right, so the key takeaways that we want to just continue to consider as we are in your different fields and what that looks like, or if you're receiving here and you are a mother as well, and you're wanting to engage your father, the father in the mental health and wellness and providing that support, just understanding that father's mental health is vital to the overall family wellness, right? So this is a topic that should continue to be explored, to be just kind of in conversations and continue to be supported, because we know and have found through research that the fathers that are engaged in their and are getting supported through their mental health, it is a benefit for the family unit as a whole. All right. And then also just considering again that paternal and maternal well-being are interconnected, right? It's not two separate things, but it's interconnected as it relates to the family unit as a whole. The mothers and their well-being and wellness and the support that they receive, the fathers are just as important, and it is just as vital to ensure that they are receiving the same tools and support that we would provide for the mother. And that goes back to the early part of psychoeducational and tools and understanding of some things that they may face as the early years of parenthood and what that can look like even beyond, right? Then also just considering that professionals can lead the way in creating more inclusive perinatal systems, right? The professionals can lead the way in creating more inclusive perinatal systems and what that can look like, whether it's in our mental health spaces, in the healthcare spaces, during appointments, and all of the different areas and what that looks like. Just understanding that the professionals can also be a vital piece into the psychoeducation, into preparing the fathers for the journey along with motherhood, and creating that space to feel, again, as I said, that safe space to kind of talk about and hone in on some of the issues and the areas that they would be concerned about. All right. Any questions, comments so far? Okay, I want us to again just take notes and kind of go back as we're talking about the takeaway of the father's mental health. Kind of just kind of brush through this, but I want you to I want to go to reiterate and just kind of revisit some of the signs that we are to just consider and look out for when we're thinking about what does that look like? What does that look like for me to just have some kind of signals or signs that the father may be experiencing some mental distress as it relates to paternal mental health. If you see some withdrawing from the partner or the baby, right, or even friends, right, that's a consideration that we want to consider, right? If they're becoming easily irritated, angry, short-tempered, right? Beyond the norm of what that would look like as it relates to even communication and their overall just personality norms of things that you see as a sign that it looks like those things are being more noticed, right? Sometimes working again excessively to avoid the stress, right? They're not able, you may hear them, the mother says, that we're not communicating, we're not having that time, that bond as we used to, right? Showing less interest in activities that they once enjoyed. Sometimes you may see an engage in increased alcohol or substance abuse. If you hear signs of expressing hopelessness or worthlessness, or again, the guilt that can sometimes be attached to them feeling the helplessness that we talked about earlier, right? Reports of frequent physical complaints, right? Sometimes we've kind of failed to connect this thing as a whole, that all that is usually interconnected when it comes to physical signs or physical complaints, fatigue, headaches, right? Stomach issues. And we know that even oftentimes if we go into our primary care appointments, sometimes they're going to ask if you're dealing with headaches or stressful signs or symptoms that they see, high blood pressure. They're going to interconnect also your mental health and wellness as well with asking questions like, tell me what's going on in your life, what things are maybe some stressors that you're having, because they realize that it's all interconnected. It's all something that they should just kind of consider when you're looking about and when you're looking at the overall wellness, right? And so if there are excuse me one moment to make sure this doesn't fall out. All right. If there are signs of physical symptoms that are being frequent complaints, that's one of those flags that you're looking out for to see as it relates to the paternal mental health. All right. Okay. When we talked about the how it can affect the overall wellness of a family, I want to just kind of go over some of the things. Wasn't sure if it would provide time, but how supportive fathers improve the outcomes for mothers and their babies. The enhanced partner support, emotionally healthy fathers have been researched to provide stronger emotional and practical support for mothers, right? Improve maternal recovery, reducing the risk of maternal depression and anxiety. Better bonding, talked about that. Engaged fathers promote secure attachment and emotional regulations in the infants. And overall healthy family dynamics, shared caregiving fosters teamwork, reduces conflict, models healthy emotional expression. And then some of the long-term benefits have been shown that children with involved fathers in those earlier years, right, getting the support that they need. It has been statistically shown that fathers show it involves fathers have been linked to children showing better academic, social, and behavioral outcomes. All right. So let's take a time to reflect. What's one insight that you'll take away from this session, or just kind of have as an even just more foundation to grow on what you're already doing or what you're already experienced, or even some of these is probably just a view of some things that you've already been putting into practice or just thinking about as it relates to paternal mental health. Share some of your thoughts. What's one insight that you'll take away or continue in conversation? Okay.
Someone put in the chat, Father Matters.
Father matters. Yes. Yes. With all that's being said, that's what I wanted you to get, that these fathers matter, that they matter. Absolutely.
I think for me, having one foot in the hospital and one foot in the community, just,
Mm-hmm.
continuing to bring them to the forefront. As you mentioned, there's, so oftentimes we put the focus on the mom and put the focus on the baby, and no one really just even checks in. So, just from a practitioner perspective, but also from a community perspective, just trying to loop the dad in any way that we can
Yes,
to break the ice.
absolutely. Absolutely. Anyone else?
Someone else shared paternal health matters and is intricately connected to maternal health and child health.
Absolutely. Yes. Yes.
Another comment, continue to include dads in the conversation and in the process.
Mm-hmm. Absolutely.
It's Serena again. How you doing? I'm trying to find a way to really word it because you know how they say with babies and kids, like Miss Cynthia was saying, we always focus on mom during the pregnancy, and then the
Mm-hmm.
baby afterwards. It takes a village for the child.
Mm-hmm.
But I feel like we are they are a village and we're trying to give them our village. So we want every part to be inclusive. Mom, dad, baby. We want everybody to share in the wealth of this village. So whatever it takes to make it a healthy pregnancy, a healthy baby, and a healthy family.
Yes. Yes. Thank you, Sharina, for that. And just as a final thought, does anybody have any just thought that you can add to how do we make them feel safe? Like, how can we make fathers feel safe as it relates to just the check-ins that we would have or the support that we would give them? So they won't feel that vulnerability. They won't feel, the insecurity of expressing that they may be having some challenges as it relates to their wellness. What's one of the ways that we can, or one thing that we can do?
I think first, just acknowledging that they are there, letting them know
Yes.
that they're being seen.
Mm-hmm.
And again, just, initiating an icebreaker so that they can begin to want to say something, anything, no matter what it is.
Mm-hmm. Mm-hmm. Absolutely. Absolutely. And I think that was one of the conversations that when I was saying I was talking earlier with my husband, and he said the same thing, for someone to just let me feel like I was seen in the matter, like, that I was a piece to this, the part of this journey. So just being seen, and then we know how powerful sometimes, but we sometimes tend to not realize how powerful validation is, because the humanity is in us. We don't want to see someone distressed. We don't want to see them going through. So we want to fix it, and we want it to just be well and okay. But sometimes that support and the greatest strength you can give someone is just validating their feelings so that they can be heard. Yeah. Anyone else have a comment or thought on just how we can provide that safe space for supporting paternal mental health? What does that actually look like?
I think piggybacking on what you all are saying,
Mm-hmm.
especially for my husband, one of the things he said, like kind of breaking that generational curse of um making fathers feel like they are supposed to stay at like the wayside or be in the background.
Mm-hmm.
For him, even as like when he's parenting, he's like, oh, well, this is what it looked like when my father parented, and I have to change that perspective. Like, I want to be more proactive. I want to be more involved. So just letting them know that that opportunity is there and that it is valued and it does make a huge change for everybody, mom, child, everyone. Like you said, the whole village. So
Yeah.
just letting them know that they don't have to stay in that generational like
Mm-hmm.
shadow of what it was supposed to look like for their father or their grandfather, that they're allowed to step out of that shadow and be what they want to be and what they feel their children need, or what they even thought they
Yes.
needed when they were a child. Like
Yeah.
I could have
Mm-hmm.
used this as a child. I wish my dad would have done this for me, kind of thing.
Mm-hmm.
I know his therapist has thrown that at him a couple of times and it's really changed his perspective on things. So just letting them know, like, it's okay to be a part of the conversation. Nobody's going to push you out. We'd actually prefer that.
Mm-hmm.
And letting them feel safe in that, like you said, validating, hey, yeah, you are wanted here.
Yes, absolutely. Absolutely. Thank you, Becky, for sharing that. Yes. And one thought that also just came up of just when we are just sharing tools with the mom is making that a part of it, of just sharing some ways that she can check in with her spouse or the father as a caregiver, just giving her some tools of questions is to kind of check in to and teaching her or sharing with her rather some signs to just kind of be aware of. Not that she has to be the therapist or anything, but just being able to just kind of see some of those warning signs so she can understand, because sometimes she can take that internally with all that's going on and she may feel like I don't want anything else added to my list, but being able to help her to see that the input that you would put in supporting the father's mental health and wellness is going to be a benefactor to you as well
Yes.
and the child. Yes.
And just to add, I think
Mm-hmm.
change is very important. It's the young lady Becky was just saying, from the generational curse to
Mm-hmm.
even, our new generational things. Change and what matters, because like back in the day, fathers wasn't a part of baby showers.
Mm-hmm.
But
Mm-hmm.
that is something that I've seen now in the new generational that includes them. And I see that a lot of dads are very happy about being a part of it.
Yeah, they seem to be
They can
enjoying it,
bring
right?
they can bring
Yeah.
their friends, and it's just
Mm-hmm.
like it's not just about my my wife or my pregnant girlfriend now, and it's about me as
Mm-hmm.
well. And then also just making them aware of the stages of pregnancy, like what a pregnant woman actually has to go through, from the hormonal changes to the nights of feeling, not supportive, just
Mm-hmm.
when the first prenatal depression and all postpartum depression, just
Mm-hmm.
feeling like, what am I to do? I got a baby now and I don't know what to do. What if the baby's crying and I don't know what to do? These are some of the things that and I feel like dad should be in on these meetings as well, just the stages of
Yes.
the pregnancy.
Absolutely, absolutely. And because we know, Serena, that education in itself, that psychoeducation in itself of just getting an understanding, all that get an understanding. When you begin to understand something, you're better able to be supportive, and you're not internalizing that as something, that conflict between that it's me or what am I doing wrong. You can be able to understand, hey, these are some of the things that are norms. These are things that you should be aware of and look out for, and they can have that understanding to better communicate with one another as well. Yeah. All right. Thank you all for allowing me to share with you all today. I wanted to be able to have at least 5 minutes for if there were any additional comments or questions. And if not, we'll turn it back into Ronnie.
I do have a quick question, guys. As it relates to getting more information and education out there to support dads, is there going to be an opportunity for us to also train them or train individuals to train individuals to provide support to dads in different places and spaces. I asked because I came through your organization and I took the training for a mental health aid first responder. But I think that this is also just information that, you know, should widely be disseminated because we do need to get fathers more engaged and their health does matter. And, them being healthy and well and certainly able to support moms is just going to be beneficial for the baby. So I was just curious if there was anything more that may be coming from your organization as it specifically relates to dads and fathering and the education that you provide.
Yes, we don't have anything right now, but one of our goals with Healthy New Moms is definitely to expand past just focusing on mothers and infants, and to focus more on fathers, which is why we do, webinar series like this. But I would say definitely keep your eyes posted on our website, which is where we'll post things and share updates on more training events. But yes, that's definitely a goal is to focus more on fathers and the family system as a whole.
Okay, perfect. Thank you, Rome.
Mhm. Awesome. So, if no other questions, again, I just want to thank our guest speaker, Verlene Harry, and the Well Network. This was such a powerful. Oh, okay. I see Parklands has a question. I'm sorry. Go ahead, Parklands.
Mhm.
Hello, my name is Parkland. Um, I'm actually building a mobile app called Baby Mom C
Mhm.
that I'm building it to help prevent postnatal depression
Mhm.
and support the postnatal recovery. And from research, I found this platform, and I'm building it from my experience in my experience as a first-time dad, experiencing new birth and figuring out not knowing how best to support my partner, seeking help online and not seeing anything that could help, and resulted to trying to build something that should exist as a result of my own experience and what I went through and what my family as a unit and my partner went through. So, but my question would be, with this conversation around fatherhood, do you have plans to expand into more practical avenues or channels that could help make it a reality or that could turn it into to become a concern worthy of attention, especially for fathers and one that helps it to reach the dads? Because I'm not sure they're even on this on this call. I think I'm just the only that here. That's just a brief question.
Yes, and thank you so much for that question. 100% yes. And what we can do, I believe it will be, or if not already, will be posted in the chat. Our email for the Healthy New Moms program. We love working with organizations in the community. Obviously, there is such a need to focus more on fathers. And so when that is shared in the chat, please feel free to reach out to us. You can, go to our website as well. We, like how I mentioned, we don't have anything concrete right now. We're in the brainstorming stage. We're, wanting to do webinars, gauging the interest in the community. But it's clear from this that there is such a need. And that email, once it's posted, is info.healthynewmoms@mhamd.org. Again, info.healthynewmoms@mhamd.org. Yes. And then I see Sharina's hand is up as well, too.
Well, I just wanted to say thank you so much for this training. It was very enlightening and I did gain a lot from it. I also wanted to thank all of the ones who shared the resources for the dads, because I do encounter with a lot of pregnant women, and sometimes the dad does feel like they're not included. So I do thank you for those resources, and I thank you for this training.
Yes, and thank you all so much for being a part of this conversation. Thank you to Verlene and the Well Network as well. It's been posted in the chat, but certificates of attendance are available. Again, these are not CEUs, they're just certificates to document that you were here and present that we will share out. You'll also receive a follow-up email with the link to the recording and of this presentation, as well as a survey asking for your feedback. We just like to gauge the usefulness of these different webinars that we're doing for the future. If you are a professional or provider and organization and you're interested in serving as a guest speaker for an upcoming Healthy New Moms webinar, or if you're just interested in learning more about ways that we can work to support families in the community, there is a link posted in the chat that you can click and submit your information, and we will get back to you. But that is it. Again, thank you all so much. Thank you, Verlene, and the Well Network. We look forward to working with you all to continue to support mothers and infants and fathers and families
Absolutely.
in Maryland. If you have any questions, again, feel free to email us at HNM, sorry, at mhamd.org. Thank you all and have a great rest of your day.